Welcome to Let's Talk About Health, an informational podcast that gives you insights on health and fitness from experts themselves that you can apply directly to your own personal health and fitness stories. Come join me today to hear all about what they have to say on health and fitness. Thank you. Thank you so much for taking the time out and just speaking with me. I know you are one of the most reputed, pelvic health coach in your area, and you just started your business and you're doing amazing. You are a coach, a teacher, so it's an honor to be speaking with you. And thank you for thank you for removing the time out to speak with me today.
Yeah, definitely. Thanks for the invite. This is super fun.
Yeah, it is. Let me start by asking you my favorite question. What, according to you, is health?
Whew, that's good. What is health? I would say health is balance, life balance. I don't think that health necessarily has to mean that we don't specifically have to talk about health in regard to like our gut health or our heart health, specifically kind of all encompassing. And so I feel like health is good life balance. And if you don't have that good life balance, then more than likely that's going to impact your health at some point.
Right. True. What's the difference between health and fitness, according to you?
So I would say kind of, going off of what I just said in regard to health, that kind of being all encompassing. Fitness, I would say, is probably more along the lines of movement or the specific activity or the specific hobby or action or movement. Health more, I would say, is kind of all encompassing of your whole being.
So that's basically health is just, individual component that you try to focus on. I like that. That's very different. That's actually so true. We think about everything mixed, but we need to look at the body as one, and we need to work on our body as one. That's nice, insightful. Can you tell me, how did you get into pelvic health and pelvic health coaching and teaching?
Yeah. I am a physical therapist, and I worked my first job out of school. I worked in an outpatient clinic, and I was the only female therapist. And so the therapist that was there before me had started to establish a pelvic health patient population.
Right.
And so when I went to that first job, they said, "Hey, you're also going to do pelvic health." And I said, "I don't really want to do that at all." And they said, "Well, this is what you're going to do." So the gal whose place I took came back and helped kind of coach and educate me a little bit. And I immediately fell in love with it. I thought I was going to be a sports med PT. And I did that, a little bit as well. But the more I worked with pelvic health patients, the more I fell in love with it. And then moved to a different area because of my husband's job, and then really started to kind of hone in and develop my skills and develop my specialty. Right. And then about 7 years ago now, which is kind of crazy, I opened my own practice. And so now I primarily just specialize and see pelvic health patients.
So the practice, I know we were talking about that earlier.
Yeah.
It's like a group. Now you have it quite expanded.
Mm-hmm.
Did you start it all by yourself and then
I
add other
did.
specialties? Wow.
Yeah, I actually in this room right here is in my
Really?
house, and I bought a massage table and started seeing some patients. Not pelvic health patients right away in my house, but I started seeing some patients and kind of just decided that I wanted to try it on my own for a little bit.
Mhm.
And so then I got enough patients where I needed to go rent a room somewhere. And just it kind of kept growing organically. And then eventually left my really well paying, stable job, which was terrifying, um, and opened my own practice. And I worked on my own for about 4 years and then decided I needed to expand and hire. And so then I just finished, I've been in my new clinic. We did a whole build out for my new clinic. I did that about a year and a half ago. And so now have 3 other providers working with me.
Wow. See,
Yeah.
that's inspired.
Yeah.
That is so inspiring. That's what,
Or crazy,
yeah,
one of the two,
no.
both, a little bit of both.
Inspiration comes from
Mhm.
something crazy.
Yeah. Yeah. That's great. That's great.
So I
Mm-hmm.
I I agree with you. Yeah,
Mm-hmm.
taking a decision that scares you
Mm-hmm.
is really so inspiring, and you dedicating and putting in so much work is the
Mm-hmm.
definition of inspiration.
Oh,
So that's awesome.
thanks. Thanks.
Congratulations on
Thank
your
you.
business, on
Thanks.
expansion, and many more to go.
Mm-hmm. Yeah, right.
Yeah.
Yeah,
Or
maybe.
I sure want to come visit though sometime.
Yeah, that would be fun. Yes.
Right?
Yeah. And you said New Jersey, right?
Right?
And so you know what snow is. I mean, I'm in Wisconsin. Like, yeah. So you're not scared of snow.
But I don't like it though.
Yeah. Yeah. Then maybe don't come to Wisconsin until next year. It's gonna start snowing and it won't stop for a few months.
Probably drop by during the summer.
Yeah, that's great. It's very beautiful here in the summer.
That's
Mm-hmm.
awesome. Can you
Mm-hmm.
tell me more about how you take the coaching or the classes for pelvic health?
Yeah. So I primarily see patients one-on-one as a pelvic health PT, but then we do small group classes. So some of the other providers that work with me, we have an orthopedic PT, and then we have another physical therapist who does a technique called fascial counterstrain. And then we have another provider who is a functional nutrition provider, and she also does a technique called visceral mobilization. And so she and I offer quite a few educational classes, specifically on menopause. This month, we're doing one on bladder health. And
Right.
so we open it up to members of the community, our patients too, but also members of the community. I mean, it's a way for us to kind of get new folks in our doors. But we just kind of take a topic and we talk about various things just about education. So like our goal is, we want to educate, we want to empower. And because we have a clinic that's maybe a little bit different than your traditional PT clinic or your if you go to the hospital and see a physical therapist, we do things just a little bit differently. And so it's a way for us to educate members of the community and empower them to be their own advocates and to maybe question things that other providers are saying, not necessarily out of, not question them in regard to they're saying something wrong, but just saying like, hey, I've also educated myself and I want to just, ask some questions and have a conversation versus, our providers just kind of telling us what we're supposed to do.
Right.
And so obviously we hope that those folks then that are coming to these classes stay with us. But
Mm-hmm.
to be 100% honest with you, it's just really trying to educate people that health and fitness, honestly, like what we were talking about, it doesn't have to look the same for everybody.
Right.
And it shouldn't look the same for everybody. And so what might work for you might not work for me, and to just give people a little bit of information and knowledge and education to help them make those decisions on their own.
Right. What are few of the most common cases that you come across in pelvic health?
Mm-hmm. I would say um, my kind of, I would say the most common patient population that I see is I see a lot of patients with pelvic pain.
Right.
Um, and so that could be someone who I have kind of a group of patients that I see who have not even gotten to the point where they've been able to have intercourse or insert a tampon and have pelvic pain to the point where they kind of just need to work through that.
Right.
I have a population of patients who are preconception, pregnancy, postpartum, and so working through some of those things also, in the realm of pelvic pain, postpartum as well. And then I kind of have another group of patients who are more in the menopause transition. And so really, the whole range. And so a lot of pelvic pain patients, but then, you have the patients who have incontinence. We see a
Right.
lot of patients with constipation, and those kind of,
Right.
those obviously overlap a lot. And then it has been really nice to have kind of more of an orthopedic, kind of more of an orthopedic provider as well, because then we can really start carrying over, okay, I'm seeing this postpartum mom, but then she also wants to get back into running. And so then I refer her to someone else in the clinic so that they can do the running eval and running assessment, and they can make sure that her form is okay, and I can make sure that and help her so that she's not leaking. And so it's been really fun to be able to work together
Right.
like that.
Right. Yeah. One body,
Yeah.
but yeah, it's such a good
Mm-hmm.
thing to have all specialities together.
Mm-hmm.
I did my internship in India. At that time, we had like a huge hospital, and we were lucky enough to have the experience to work in each and every field,
Mm-hmm.
stay connected with every field.
Yeah,
So it's it,
exactly.
it's really good to have people with different opinions. And like you said, like running, the rehabilitation, the goal for rehabilitation is just to get back to sports and
Mm-hmm.
recreational activities.
Right.
So it's very important
Mm-hmm.
to have ortho support with you.
And it's great, like you said, when doing your internship, it's great when you can work in a facility where people do work together.
Right.
I've worked in a facility before where that wasn't the case, where, OB and pelvic health PT weren't necessarily speaking, or they weren't necessarily working together. And to me, that was kind of just crazy. And so I think it's so cool when you can experience something like that, where people, um, different components of care are really coming together. So
Yeah,
that's neat that you had that experience.
definitely. Can you tell me how much you love Kegels and
So I don't actually
what?
recommend Kegels that much. No. So yeah, Kegels I would say are it's really just kind of a range of motion exercise of your pelvic floor muscles.
Right.
But the analogy that I use a lot is that, like, if you think of your biceps muscle, so if you're walking around all day and you're holding tension in your biceps muscle, you wouldn't tell a shoulder patient to go do a whole bunch of bicep curls, right?
Right.
And in
Right.
so many of us are holding tension in our pelvic floor. So many of us are sucking in, like we're sucking our bellies in, we're holding tension in our glutes. And, just as female beings, a lot of us hold our control in our pelvic floor.
Right.
And so a lot of patients that I'm seeing, specifically my pelvic pain patients that I'm seeing, are holding too much tension in their pelvic floor. And so they might come with symptoms of incontinence, but just because they're leaking doesn't necessarily mean that their pelvic floor muscles are long and weak. just like, the biceps. You could have shoulder pain, or you could have, some instability or something in your shoulder, but you wouldn't tell them to go do a whole bunch of
Right.
bicep curls. And so it's the same thing. The pelvic floor is just another muscle group, just like any other muscle group in the body. And you have to look at it. You have to make sure that it can fully lengthen, that it can fully contract, that it's coordinated through its full range of motion. And so I very rarely just recommend Kegels. We do different forms of Kegels, or, different types of pelvic floor muscle contractions. But not very often do I recommend Kegels.
I thought what squat is to orthopedic PT, Kegels is to pelvic floor PT.
Yeah. Yeah, right. And so I would say no. I recommend it, to be 100% honest with you, Bhavna.
Yeah.
I probably recommend squats more than I recommend Kegels.
No way.
Yeah,
Really?
totally.
Because that helps relax, right?
Yeah, and also it helps with other muscle groups.
Right.
And so, if you have a strong core and you have strong glutes, or you have strong quads, I mean, that also feeds in. And so it really is kind of taking a step back and looking at lumbar range of motion, looking at hip mobility, looking at core activation. Are their adductors tight versus their abductors are long and weak? And so sometimes we're finding that folks are holding tension in their pelvic floor muscles, maybe because of an imbalance outside of that, and they're trying to use their pelvic floor muscles to stabilize.
Right.
And so if you do the pelvic exam and you're not really finding a whole lot of imbalances, then you kind of start to look outside of that just a little bit.
I never thought pelvic floor muscles could be used as compensation.
Yeah, lots, yes, most definitely. And so if you think of someone, if you think of the abdominal canister, and so the diaphragm and the pelvic floor and the abdominal wall, we're all just trying to manage pressure, right? And so there's this whole pressure management system. And so if you have weakness somewhere else, if you have a large diastasis, or if you have a hernia, or if you have a disc injury, or even if you have like instability in your hip, the pelvic floor muscle group it's very big, and it can be a very strong muscle group. And so a lot of times, if you think of that, that's kind of, it's the base of our core. And so if you have weakness somewhere else, you could be compensating and overusing some of the pelvic floor muscles to try to stabilize.
Well, what exercises would you recommend in such cases?
Diaphragmatic breathing.
Okay.
And just kind of like, the biceps analogy, the goal is to get the pelvic floor muscles to lengthen.
Right.
So that then, because you can have a short, weak muscle as well.
Correct.
And so the goal would be to eventually get the pelvic floor muscles to lengthen, and then we would maybe take them through strengthening. And so honestly, whether I have a shoulder patient or a neck patient or a pelvic floor patient, I typically start patients with diaphragmatic breath, because that's kind of that's our core, and that helps us with our pressure management system.
Right.
And so then once we do that, then we find where their imbalance is. So it might be their pelvic floor, and so we might do a pelvic floor muscle contraction, or one that I like to give, they're called elevators, where you just slowly and gradually contract your pelvic floor muscles up and down through the full range of motion. But we might also do some core exercises. We might do hip stability,
Right.
or mobility exercises.
What are the chances that gluteal muscles are weak in such cases?
I would say, I mean, it really kind of depends on the patient and what's going on. But I think specifically in women, I feel like, and that might be a little bit of an overgeneralization. So, but I feel like a lot of times women have, weaker glute medius, glute minimus, glute medius.
Right.
muscles, not always,
Mhm.
but I do feel like that is a muscle group that we find that there's weakness in most often. And so sometimes we might focus more on glute strengthening rather than isolated pelvic floor strengthening.
Right. Well, you said that you recommend squats
Yeah.
for a lot of your patients.
Mm-hmm.
Will that help lengthen the pelvic floor muscles?
Um, I would say the like deep yogi squat posture is one, if it is available to the patient.
Right.
It is a posture position that I do like to have people work on their breath in.
Mm-hmm.
It's a great way to get them to kind of lengthen their adductors, and yes, to help them lengthen their pelvic floor. But I really like squats more kind of for a pelvic floor strengthening exercise in a sense, just because
Right.
it strengthens the whole system, and it's so functional.
Right.
And it really, you really do have to be coordinated in order to manage your pressure system at the same time that you're doing that movement.
Right. Another question that I had, during menstruation, a lot of
Mm-hmm.
women have abdominal pain, pelvic floor, like the
Mm-hmm.
lower belly pain. Do you recommend
Mm-hmm.
exercising, or you recommend rest, hot water bath? Because there are different
Oh,
theories.
that's a good question. That's a great question. I love that question. So obviously the answer that I'm going to give you is it depends, right?
Right. True.
But
True.
I would say so, and I think this answer can encompass so many topics in the world of women's health and pelvic health,
Right.
is that I I I don't want us to feel like we're broken.
Right.
I don't want us to feel like we have to just lay on the couch in sweatpants and eat Cheetos during our menstrual cycle, right?
If
If
you
that
good
is
though.
what makes you feel better, great. Go for it. And some days that is what makes you feel better. But
Right.
movement can be so powerful
Right.
during menstruation. Maybe not the time to be working on your PR, but maybe a time to continue to move, which can actually significantly help your symptoms. Um, and yes, like a hot bath, a hot shower, a hot pack, like if you do have, severe menstrual cramps or other symptoms, um, trying to do things that are soothing and make you feel good will be helpful, but definitely don't discount movement or don't assume that you shouldn't be moving at that time. But then my follow-up question to that would be, why are your menstrual cramps so bad?
Right.
And so maybe trying to dig a little bit deeper, maybe trying to peel some layers back a little bit. And then that's when I would maybe have you meet with our functional nutritionist to try to figure out if there's a reason why why you are having such severe menstrual cramps, and maybe there's some things that we can do to make that better,
Right.
so that you do then feel more like movement and not laying on the couch in your sweatpants eating Cheetos, which again is totally fine. No judgment, zero judgment.
Right.
I've done that as well. But I do feel like movement can be very beneficial.
Right. What about like deep squats, or like the regular cardio, or the I wouldn't say aggressive,
Mm-hmm.
but a regular workout? Would that be too much for, well, talking about blood loss, or talking about
Mm-hmm.
just cramping pain?
Yeah, I mean, I honestly would say that is such an individual thing.
Yeah.
I honestly don't think that there's outside of really trying to like max out. So that's not a time where you should be really trying to like max out and
Right.
right. But I don't think that there's really anything that I would tell you outside of that not to do necessarily if it feels good. If it doesn't feel good and you're feeling weak, specifically if you have a significant amount of blood loss, if you're feeling weak, yes, don't go, run a marathon or don't go lift like big heavy weights that day. But also, if you feel okay, and that's something that makes you feel good and releases endorphins, then I would say go for it. And I mean, since you're asking about things that would help, and I mean, this is a little bit intense, but honestly, having an orgasm is one of the ways which, people are like, well, I don't really want to do that when I'm having my period. But
Right.
if that ever works for you, that is one of the things that can significantly help menstrual cramps.
Okay.
It,
I did not
yeah,
know that.
I know, right? I know, right? Right? Everybody's like, I'll go try that. That's not a problem at
Right.
all. And so, right. And so, movement, eating healthy,
Uh-huh.
trying to stay hydrated, and then, sometimes having an orgasm can also be beneficial during that time for menstrual cramps.
Right. Yeah, because there is like a misconception or a norm that don't move a lot,
Yeah,
uh, or
totally.
don't go work out, don't
Myth.
go like crazy dancing.
Yeah.
So,
If it feels good, do it.
right.
And again, I'm not saying that I'm not saying that everyone should go and do that. If you don't
Correct.
feel
Correct.
well, right, then don't go do those
Correct.
things. But don't feel that don't feel like that you shouldn't or that something is wrong if that feels
Right.
good to you.
Right. Yeah. Yeah. The Thank you for clearing that out, because
Yeah.
there was always like a fear too with
Mhm.
one growing
Yeah.
up, that you should just stay at one place,
Mhm.
which makes sense too,
Mhm.
because you're so drained.
Yeah.
You're already losing so much blood. You're
Mhm.
going through a million emotions at one time, and
Mhm.
you're just exhausted. So
Mhm.
I get that feeling, but there's nothing wrong in doing
No.
it if you want to.
And a lot of times what I tell people, like I would say the most important thing to do if we're talking about menstruation, the number one most important thing to do is track your cycle.
Right.
Even if you are on a hormonal birth control, which controls your cycle, still track your cycle. Even if you're on a hormonal birth control that stops your cycle, still track your cycle because we are cyclical beings. And so track your mood, track your cervical fluid, track your bowel movements. Because typically, and again, this is a little bit of a generalization, but around the time of ovulation,
Right.
you might have a lot of energy. Like that's our body telling us, like, go out and find your mate, go out with your girlfriends, like here's all of this energy. And then during the time of menstruation, that's the time when our bodies are telling us to maybe kind of lay low just a little bit. And so really track your cycle and listen to your body. And so if it feels good and you want to go out and push yourself, or you want to come up with a new idea at work, then maybe that time around ovulation is the time that you feel that you can produce the most, or you feel like you can be the most energetic. And then maybe when you're looking at your calendar, maybe don't plan some big huge social event around the time of your cycle if you can avoid it, because that time's going to come and you're going to be like me and be like, I'm kind of feeling antisocial right now, I don't really want to go, and then you've made all these plans. And so
Right.
again, not saying that we all have to fall into that, but tracking your cycle and getting to know yourself can be so, so, so empowering.
Right.
And so I tell all of my patients that's kind of the number one thing that I want them to do.
That's really nice idea. I think
Mm-hmm.
I will start, doing that for
Mm-hmm.
myself, and
Do.
also educating my patients to do that.
Mm-hmm.
Yeah.
And the other thing is, I could obviously talk about this for like, this is like one of my favorite topics, but it really is empowering because it also kind of makes us realize that we're not crazy. And so, maybe if you start tracking it, you're going to realize like, I don't actually have something structurally wrong with my back. I don't structurally have something wrong with my hip. Maybe just during that time, I'm realizing that this is happening once a month. And so maybe it's just, I'm just having a little bit of back pain, or like, I'm not crazy. I just am a little bit moody for this 1 or 2 days every month. And I don't need to go be put on an anti-anxiety medication or an antidepressant,
Right.
because if I really just look at my calendar, it's just because I'm having a little bit of PMS and I'm going to go for a walk and make sure that I get to go to yoga today
Right.
or do something to try to help that, versus trying, getting in that cycle and getting in that, and yeah, falling in that and trap. And so I feel like if you can just look at that data that you've gathered every month, it is so empowering to just learn so much about your body.
Yeah, and you know your body the best,
Mm-hmm.
so you have to keep a track of it. That's
Right.
true.
Yeah. Yeah.
Talking about menopause, what are
Yeah.
the most common um, problems that you come across with patients with menopause?
Mm-hmm. So I would say, the kind of the most common symptoms that folks come in with, um, the most common that everybody kind of knows about are hot flashes.
Right.
Um, but then we also, kind of the common ones that we're hearing are low libido.
Right.
So hot flashes, low libido, weight gain,
Mm-hmm.
and not even necessarily weight gain, but a shift in where we carry our weight, which is very, it's definitely based on evolution. And as we're moving from our reproductive years into our menopausal years, our where we carry our weight definitely shifts. Um, Mood changes.
Mm-hmm.
And then one of the most common ones that we see, just because of the type of clinic that we are, is diffuse pain. And so our tissue structure actually changes. And so people will come in and they'll say, I think I'm crazy. I feel like I'm falling apart. That's a statement that folks make very often. I have shoulder pain. I have this hip pain. I have plantar fasciitis. And it's all this, tendon, it's all this uh, like tendon issue that they're having. And so really, and you do want to maybe go and address like each of those body parts and just make sure that there isn't something else big and scary going on. But when you start to see kind of a systemic presentation like that, yes, you can go and address those those body areas in that pain, but you also want to take a step back and you want to look at their sleep, you want to look at their nutrition, you want to look at their movement patterns. Are they stressed? Looking at all of those other areas of their life, because maybe they're not sleeping and maybe they're really stressed, so they have like crazy high cortisol levels. And so if we just brought down their cortisol levels a little bit and got them to move a little bit, their shoulder pain, their knee pain, their hip pain, their foot pain, it might somewhat take care of itself.
Right. Which makes so much sense.
Mhm.
Uh,
Mhm.
when do you think is the approx range of age that you see?
Somebody going through menopause.
Mm-hmm.
So the average age of menopause. So menopause is just a hot second. So
Right.
all menopause means is that you've gone 12 months without a period.
Right.
And so menopause is just like one day, right? Yeah. And so the time that we're kind of talking about is pre-menopause, which is that time kind of leading up and starting to feel some of those hormonal shifts. And then perimenopause is the time like right before and right after. And then postmenopause is obviously the time after, you've been not bleeding for 12 months. And so the average age of menopause is like 50, 51. But we're starting to realize that folks could start to have some of those hormonal shifts as early as 35. And so if you think about that, someone might be in pre and perimenopause for 15 years. And so that's a huge chunk of our lives to just be like, I'm just going to be okay with having hot flashes and feeling like crap. And so we really are trying to educate people on things that they can do to help with some of their symptoms. And again, just to empower them so that when they go to their doctor, they are educated on some of these symptoms and why they're happening so that maybe we can do some other things about them versus just trying to treat the symptoms.
Right. I asked because when we were studying, it was 55, and then it kept decreasing. The age kept lower, and like you mentioned, now it's 50, 51. The women are getting menopause at such early age.
Yeah.
And then followed with so many bone issues and calcium
exactly. And heart disease
conditions.
Yeah, exactly.
So yeah, because we come across so many patients that that start with, after my period stopped, that's when I started to feel joint pain and knee, hip pain, back pain. So it's so, the age is dropping so low. What do you think is the reason for that age drop?
That's a loaded question. I mean, our society, like, yeah. So, environmental toxins, what we're putting on our face, what we're putting on our bodies, what we're putting in our mouths. Stress, I think, is huge. I think stress is a huge component of it. I think it's more than, we're all like, oh, I'm busy. Yes, I'm busy. I'm stressed. I don't think people fully acknowledge and appreciate the amount of impact that the stress of our society is having on our bodies. And so I guess I don't necessarily have any like data that I can spout out to you right now that backs that up or proves that. But that is definitely my opinion. I think a lot of what's happening is also why we're seeing young girls get their menses and get their menstrual periods so much earlier than they used to. I mean, my son is 11 and a half. He's in 6th grade. And, we were talking, I'm educating him about it, one, just because of what I do. And the poor kid has to talk about, like poop, and like we talk about very openly about stuff in our house. But I'm educating him about it. So in case, he has a friend at school and those conversations are coming up, like I want him to be educated about it as well. But it is definitely happening. It is definitely happening younger, for sure.
Yeah, I agree. Stress is such a big, crucial role.
It is.
We casually throw around that word, oh, I'm just stressed.
Yeah, I'm busy.
Yeah, without taking things seriously, without working on our, so it definitely has to impact our body and mind somewhere.
Definitely.
What made you join in pelvic health. Did you always think that you wanted to be in pelvic health?
No, not at all. I thought I was going to be a sports med PT. I didn't I wasn't planning on it, but
Right.
honestly, it was the I worked, so I'm from Iowa, which is
Right.
like a state in the Midwest, and um the clinic that I worked in was somewhat of kind of a rural community.
Right.
And so I started with just these kind of cute little old ladies who were leaking and, not, and peeing their pants and not, able to hold their urine and not make it to the bathroom. And
Mhm.
um, even then, it was so crazy when you opened up this safe space. So like, in our little private treatment room, you opened up this safe space for them to talk about some of their concerns.
Right.
Just that, like, even if you did no treatment or no exam or anything, just by letting them have that safe space and opening up to you was so helpful. And I can't even tell you how many patients have said, I've never had someone listen to me or educate me or talk to me about any of this. And I've brought this up to so many providers because I think it's just this weird area of the body where like people start
Right.
talking about it and we're just going to put this like black box over it because I don't really know what to do about it and you're making me uncomfortable. So let's just change the topic and
Right.
stop talking about it, and I open up the space for them to be able to talk about poop, to be able to talk about sex, to be able to talk about, how they're peeing their pants when they jump on the trampoline with their kid.
Right.
And when you just open up that space for them, that just in and of itself can be very empowering and very healing for them. And so as soon as I started getting that feeling from people, I was pretty hooked because, um, I mean, we're women and we shouldn't have to feel like these issues need a black box over them.
Right.
Um, yeah, and we should be able to talk openly. And I guess one of my favorite things is when I educate orthopedic PTs about the relationship of the pelvic floor on the core and the hip and the back and the lumbar spine. And I can, see the light bulbs going off. And then they feel more comfortable bringing some of these questions
Right.
up because, especially as a male orthopedic PT, and you have a, fairly new postpartum mom sitting across from you wanting to talk about return to running, there are definitely some questions that you should probably screen, right? And ask. And so educating them so that they feel comfortable bringing those questions up and saying those words out loud, that's probably one of my favorite things.
I love that.
Mm-hmm.
And
Mm-hmm.
who has been your role model throughout your journey?
Um, so the guy that I worked for in Iowa, his name's Steve Cassabaum. He has been kind of my mentor this whole
Mhm.
time. He's actually coming to visit me this weekend and he's coming to see my clinic for the first time.
Wow.
Um, yeah, and so I'm really excited. So he's totally randomly coming this weekend. He's been, my mentor this whole time, and I would say, in the world of pelvic health, it really was just the women that kind of came before me. There wasn't one specific person, but watching from, so I'm going to age myself just a little bit, but from when I started in 2003 until now, so I've been doing this for 20 years, the world of pelvic health has changed drastically.
Right.
And it's not just all about Kegels. And it has been so cool watching the world of pelvic health evolve
Mm-hmm.
over those 20 years. And we are doing so much more. And I think there's so much more to do, but we're doing so much more now than we were even just 20 years ago.
Right.
And so being able to be a part of that has been really, really, really fun, really awesome.
Yeah, definitely.
Mm-hmm.
One piece of advice that you would give to 18-year-old Jill?
Ooh, it's not that big of a deal. Definitely. I just, I am a little bit of I'm kind of a type A, a little bit of an anxious person. And I just, I can remember getting so worked up about things. And it's really hard to tell 18-year-old anyone, that it's not that big of a deal. But yeah, there was just lots of things that I wish I would have just let go, and
Mm-hmm.
um, you know, just not allowed to maybe drag me down. And so yeah, I would say it's not really that big of a deal. Just take a deep breath, and this too shall pass.
What what are the next projects or plans, upcoming plans on your mind that
Yeah,
you'll be
well,
watching?
maybe doing a couple podcasts with you,
Definitely.
so that would be fun. But
I'm
um,
excited. Let's do it.
yeah, right. So we are just in the clinic. We're trying to work more on building our kind of our workshops and our education platforms. Um, and we during COVID, which wow, that was crazy for sure. We kind of started to shift to more starting to build more kind of like online education. And really, we actually pulled back from that a little bit and are really, really just focusing on our community and the people that are, here, and really trying to just build a stronger presence in our community and in the clinic. I definitely think that we will continue to do online stuff and online education, but we have pulled back from that a little bit and are really just trying to focus more on building the programs and integrating between the providers. And so we have a really awesome lifestyle and nutrition program that Chelsea, one of the providers, offers. And that has been something that's been really fun and very, very complimentary to kind of any patient that we're seeing.
Right.
Where she talks about stress, she talks about hormone balance, she talks about sleep, she talks about movement, she talks about nutrition, and just ways that we need to kind of integrate and look at that as a whole, kind of regardless of what else you're working on.
Right. Makes sense. I am so excited to,
Mhm.
see you grow, work on your
Awesome.
education, and online is
Yeah,
telehealth is the next
it
step to
is.
health and science. For
It is.
so it's better, and you and me, we're both
Right.
not have good relationships with technology.
Yeah.
So
You'll
technology
have to
does
learn
not
about that.
like me. So I feel you, but
Hmm.
we're learning, we're growing,
Yeah,
and
right,
we'll
right,
get there.
right, right,
But
right.
thank you so much for today's
Yeah.
session that we had. I loved it.
Hmm.
It was so informative. It was
Good.
so inspiring. Your story is amazing, and I can't wait for us to, do
Yeah,
a podcast together
yeah,
and maybe have some educational,
yeah.
courses or online things, something.
Love it. Let's
Yeah,
do it.
I love that.
If you could just like manage the technology part of it, though, that would be really great. I'll come up with some content.
I'll do it. I'll do it. Let's do it.
We'll pull Joel in.
Oh, definitely.
Mhm.
Definitely. I don't know what we'd do, but I don't know what I'd do without it.
Yeah, that's good.
So yeah, we'll definitely have him help us.
Yeah,
But
right.
I'm excited to see where this goes, and
Yeah.
I'm very happy for you and your upcoming plans. All the very best.
Thanks, Bhavna. It was nice to meet you in
It was
person.
lovely meeting you. Have a lovely night. I know you're gonna straight run to your bed and
Yeah,
uh,
definitely.
yeah. Bye bye. Thank you.
Okay, take care. Bye-bye.
Thank you for listening to our talk about health. You can follow me on Instagram at bhavna.devnani, on Facebook at bhavna devnani, and we'll leave all the information in the description below. Thank you.